I had a dermatological problem that I believe was psoriasis on my face. As you can imagine, it was devastating. I have been on LDN 1 milligram and then 3 milligram for a total of 2 months. And as of last week, it's all gone. I am beyond thrilled. Now the question, now that I am in a much better place, could I try going back down to 1 milligram and see if it sticks? I ask because I do think my energy is a little off. Now, I would say, like we've said quite a lot during this webinar, experiment. So you'll know yourself. I wouldn't go straight back down to 1 milligram. I would maybe try 2.5 milligrams. But in my experience with this, I would stick to the dose that's actually caused the benefit most. The energy being a little bit off could be a potential problem. So yeah, try to go down to 2.5, then 2, see how it goes, but taper off slowly and maybe do it every week rather than go from 3 milligrams to 1 milligram straight away.
Well, we know psoriasis often is a dysbiosis in the gut, right? That's usually a fungal overgrowth. There can be an autoimmune condition associated with that as well. So sometimes when the energy is a little bit off, it's the result of the die-off of the bad guys in the gut. And so that could be part of it as well. So yes, I totally agree with what Janine is saying. Be very careful about decreasing your dose too quickly. And certainly if it starts to come back, go back up. And then also maybe seek other remedies to really address what's going on in the gut. Antifungal, antibacterial, whatever is
great.
Yeah, absolutely. Simple carbs, gluten-free. Yeah.
Would you tend to give a cream for psoriasis? The reason I'm asking is because a few of my patients, the LDN solution hasn't worked, but when we come off LDN and they're given the topical, it seems to work a lot better. However, that's only on very small patches of psoriasis. And I tend not to give LDN solution at the same time as the cream. What would your experience be in that?
I don't think one replaces the other, right? I think you still need to do oral, just because you got to get at the root. Now, a lot of times the topical LDN will work really well because you're actually seeing a decrease in the symptoms, right? So psoriasis is red, it's raised, it's itchy. So we know that low-dose naltrexone topically can work on the TLR9 receptor, and it actually can work on shifting TH1 to TH2. So you're going to see a reduction in inflammation and also the itching right away. So that's where the topical is really going to help, but you're not going to work centrally at that mitochondrial level, right? So that's where the oral, I think, is still very important. If you're worried about additive dose, I just don't see that much. I would still stay with your oral. And then if you need topical relief, use a little bit of topical, 0.5%, 1% LDN to that area. And that can be temporary, right? That could be like a short term. Right? Don't you think, Sam?
Yeah, I see it used for flares. Always keep with the oral. I think that's with maintenance. And then if there's like a flare, like some stressful situation, and I see topical given as well on top of oral for like those type of situations. Works very well.